What is coronavirus COVID-19? Coronavirus, officially known as COVID-19, which originated in China, as on the 25th of March 2020 has killed 20,543 people across the globe and infected 454,456. The virus has spread to 157 countries. Medical information. What are the symptoms of COVID-19 infection? The virus can cause mild, flu-like symptoms such as fever, cough, difficulty breathing, muscle pain, tiredness. More serious cases develop severe pneumonia, acute respiratory distress syndrome, sepsis and septic shock that can lead to death. Are some people more at risk than others? Generally elderly people and those with underlying health conditions e.g. hypertension, diabetes, cardiovascular disease, chronic respiratory disease and cancer are considered to be more at risk of developing severe symptoms. Are children also at risk of infection? Disease in children appears to be relatively rare and mild. A large study from China suggested that just over 2% of cases were under 18 years of age. Of these, fewer than 3% developed severe or critical disease. What about pregnant women? In pregnant women, the severe versions of SARS and MERS coronaviruses were found to be severe. According to reports, women who suffered from severe versions of coronaviruses had stillbirth. However, there is limited scientific evidence on the severity of illness in pregnant women after COVID-19 infection. That said, current evidence suggests that severity of illness among pregnant women after COVID-19 infection is similar to that in non-pregnant adult COVID-19 cases, and there is no data that suggests infection with COVID-19 during pregnancy has a negative effect on the fetus. At present, there is no evidence of transmission of COVID-19 from mother to baby occurring during pregnancy. Will the coronavirus spread through cough or sex? Coronavirus is highly contagious. The disease can spread from person to person through small droplets from the nose or mouth which are spread when a person coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch the virus by touching these objects or surfaces, then touching their eyes, nose or mouth. People can also fall victim to virus even if they breathe in droplets from a person infected who coughs out or exhales droplets. How is coronavirus diagnosed? Doctors may recommend the patient to undergo tests on respiratory specimens and serum to detect coronaviruses. If anyone experiences the symptoms, they must inform their doctor about recent travel or contact with animals. Is there a vaccine for coronavirus? There is no specific treatment for coronavirus, and no vaccine to prevent it. How contagious is coronavirus? Coronaviruses are highly contagious. Coughing and sneezing without covering the mouth can spread the virus. Touching hands of a person that has the virus can pass the virus from one person to another. Making contact with an object that has the virus and then touching your nose, eyes, or mouth can infect a person. A coronavirus may spread through contact with feces. Is there a treatment for the COVID-19 disease? There is no specific treatment for this disease, so healthcare providers treat the clinical symptoms, e.g. fever, difficulty breathing, of patients. Supportive care, e.g. fluid management, oxygen therapy etc. can be highly effective for patients with symptoms. Prevention. How can I avoid getting infected? The virus enters your body via your eyes, nose and/or mouth, so it is important to avoid touching your face with unwashed hands. Washing of hands with soap and water for at least 20 seconds, or cleaning hands with alcohol-based solutions, gels or tissues is recommended in all settings. It is also recommended to stay 1 meter or more away from people infected with COVID-19 who are showing symptoms, to reduce the risk of infection through respiratory droplets. What should I do if I have had close contact with someone who has COVID-19? Notify public health authorities in your area who will provide guidance on further steps to take. If you develop any symptoms, you should immediately call your healthcare provider for advice, mentioning that you have been in contact with someone with COVID-19. Are face masks effective in protecting against COVID-19? If you are infected, the use of surgical face masks may reduce the risk of you infecting other people, but there is no evidence that face masks will effectively prevent you from being infected with the virus. In fact, it is possible that the use of face masks may even increase the risk of infection due to a false sense of security and increased contact between hands, mouth and eyes. Is there a vaccine against the virus? How long will it take to develop a vaccine? There are currently no vaccines against human coronaviruses, including the virus that causes COVID-19. This is why it is very important to prevent infection and to contain further spread of the virus. The development of vaccines takes time. Several pharmaceutical companies are working on vaccine candidates. It will, however, take months or years before any vaccine can be widely used, as it needs to undergo extensive testing to determine its safety and efficacy. Information for travelers. What precautions should I take if I am visiting an area of local or community transmission? Travelers visiting areas of local or community COVID-19 transmission should adhere to strict hygiene measures, wash hands with soap and water regularly, and/or use alcohol-based hand sanitizers. Touching the face with unwashed hands should be avoided. Travelers should avoid contact with sick persons, in particular those with respiratory symptoms and fever. It should be emphasized that older people and those with underlying health conditions should take these precautionary measures very seriously. What if I have recently been in an area of local or community transmission? Travelers returning from areas of local or community transmission should monitor their health for 14 days. People with symptoms should contact their healthcare specialist via telephone first, and indicate their exposure and travel history before seeking medical attention in person. Symptomatic people should avoid contact with others until they have received advice from a healthcare specialist. What is the risk of infection when traveling by plane? If it is established that a COVID-19 case has been on an airplane, other passengers who were at risk, as defined by how near they were seated to the infected passenger, will be contacted by public health authorities. Should you have questions about a flight you have taken, please contact your local health authority for advice. The risk of being infected on an airplane cannot be excluded, but is currently considered to be low for an individual traveler. The risk of being infected in an airport is similar to that of any other place where many people gather. Why are people not being checked for COVID-19 at the airport when arriving from areas of local or community transmission? There is evidence that checking people at the airport, known as entry screening, is not very effective in preventing the spread of the virus, especially when people do not have symptoms. It is generally considered more useful to provide those arriving at airports with clear information explaining what to do if they develop symptoms after arrival. COVID-19 and animals and food products. What is the risk of COVID-19 infection from animals or animal products imported from affected areas? There is no evidence that any of the animals or animal products authorized for entry into the European Union pose a risk to the health of EU citizens as a result of the presence of COVID-19. What is the risk of COVID-19 infection from food products imported from affected areas? There has been no report of transmission of COVID-19 via food, and therefore there is no evidence that food items imported into the European Union in accordance with the applicable animal and public health regulations pose a risk for the health of EU citizens in relation to COVID-19. The main mode of transmission is from person to person. What is the risk of COVID-19 infection from contact with pets and other animals in the EU? Current research links COVID-19 to certain types of bat as the original source but does not exclude the involvement of other animals. Several types of coronaviruses can infect animals and can be transmitted to other animals and people. There is no evidence that companion animals, e.g. dogs or cats, pose a risk of infection to humans. As a general precaution, it is always wise to observe basic principles of hygiene when in contact with animals. Do let us know in the comments on what topics you want us to make our next video. Don't forget to hit the like button. Also don't forget to press the bell icon to get notifications about our new videos.